This is Dr. Dewey McWhirter with Tranquility Sleep Specialists. Welcome to another Dr. Shut-Eye tip. Today, I'm going to be showing you how to adjust the ramp settings on Respironics and Resmed devices. The ramp is a feature that helps people to get to sleep before their machine really gets to its full pressure. Sometimes the full pressure on the machine is a little harder to tolerate while you're awake, so it's helpful if the machine starts at a lower pressure and gradually goes up until you fall asleep. I'll show you how to adjust this setting today so that if your pressure is bothering you, you can start at a lower pressure and not have to worry about it getting to the full pressure until after you've fallen asleep. So this is a Respironics Dreamstation device. This device has a knob that you turn to go through the menus, and then to select a menu, you're going to click on the knob. So to start out with, we are going to go to My Setup and click on that. And now the first setting we can adjust with the ramp is the starting pressure. So this 4 centimeters is the pressure where the machine is going to start out when you first turn on the ramp. The pressure setting can be set anywhere from 4 to the actual pressure setting that the device is set on. So I'm going to select this by clicking on it. And now I can turn this up all the way up to 7 because 7 is the pressure setting it's set on. So if you are having trouble falling asleep with the 7 centimeter setting or whatever your setting is for your machine, you can adjust this so it'll start at a much lower pressure and gradually go up over time to the full pressure. So to select this pressure setting of 4, I'm going to click on it. And now I'm going to go to the next setting, which is the ramp time. So ramp time is the amount of time it takes to go from this lower pressure setting to your full pressure setting. So right now it's set on 45 minutes. This particular machine will go anywhere from 0 to 45 minutes. So I'm going to click on it, and I'm actually going to turn this down to 5 minutes for now. And we're going to click on that. So now what will happen when we push this ramp button, it's going to back down to a setting of 4 centimeters, and then over the course of 5 minutes, it'll come back up to the 7 centimeter setting, which is the max setting on this particular machine. I want to now show you, let's go back up to the main menu, and I'm going to turn the device on. And what you're going to notice is it's going to start out at the full 7 centimeters of pressure. In order to get it to use the ramp, I will press this button on the top of it, and now it's going to bump itself back down to the 4 centimeter pressure setting. Now it's going to gradually go up from that 4 centimeter setting to the 7 centimeter setting over time as you fall asleep. One of the nice things about this particular machine is there is a setting that you can try. It's called the Smart Ramp feature. You would have to get the medical equipment company to turn it on, but basically what it does is it will make it so the machine starts out at a lower pressure, and then it'll detect when you have fallen asleep and increase the pressure at that point. I've had patients give kind of mixed reviews on it, but still I have a few patients that really like that setting. But otherwise, anytime during the night, if you wake up and the pressure is bothering you, you can hit this button and it'll back down to that lower pressure setting again and start another time cycle before it gets to your full pressure. So this is a Resmed 10 series device. The pressure setting that it starts out on when you have the ramp is actually set by the medical equipment company. So if you want a lower pressure setting for your machine to start on, or if you want a higher pressure setting for it to start on, you really need to tell the medical equipment company to change that for you. The settings you can adjust on here are adjusted with this knob. So the knob can be used to switch between menus, and then you click on it to select a menu. So we're going to start with the My Options menu, and we can turn this wheel and it's going to go down to our ramp time. I can click on the ramp time, and now I can adjust how long it will take for the machine to go from the starting pressure all the way up to my full pressure. So this machine right now is set so it's going to start at 4 centimeters of pressure. It's set to go up to 16 centimeters of pressure. So if I put it on 45, it'll take 45 minutes to go from that 4 centimeters all the way up to the 16 centimeters. But I'm going to turn it down so it'll take about 5 minutes to get to that setting. If you don't want any ramp at all, you can always turn this off. But otherwise, I'm going to put it on 5 minutes right now. I'm going to click on that to say that that's what I want. Now I'm going to go back to home, and I'm going to go ahead and push start, which will turn on the device and start the pressure. On this machine, you don't have to do anything else to get it to start on the ramp. So you can see it's on the 4 centimeter pressure now, and it will gradually go up over the course of 5 minutes up to 16 centimeters of pressure. If, as the pressure goes up, you haven't fallen asleep and the pressure is bothering you, you can push stop. And then you can push start again, and it will start back up at that lower pressure and work its way back up to the 16 centimeters of pressure. So with this machine, anytime you wake up during the night and the pressure's bothering you, hit stop, give it a second, and then go ahead and push start, and it's going to start back over with the ramp before going to the full pressure. I appreciate you watching again today for another Dr. Shut-Eye tip. Hope you'll watch again soon.